Human immunodeficiency virus, or HIV, is a virus that affects the immune system by attacking CD4 cells, the cells that fight off infection. HIV is the virus that causes acquired immune deficiency syndrome, or AIDS. An HIV-positive person can progress to AIDS if he or she acquires an opportunistic infection or if his or her CD4 count is less than 200. Some common opportunistic infections are candidiasis of bronchi, trachea, esophagus, or lungs, invasive cervical cancer, cryptosporidiasis, encephalopathy, Kaposi's, sarcoma, lymphoma, tuberculosis, pneumocystis carinii, recurrent pneumonia, recurrent salmonella, and toxoplasmosis of the brain. There are 3 stages of HIV. The first stage is called acute infection, where most people experience flu-like symptoms 2 to 4 weeks after transmission. In this stage, HIV multiplies rapidly. The second stage is called clinical latency, where HIV continues to multiply in the body but at a very low level. At this stage, an HIV-positive person is asymptomatic. The third stage is AIDS. Because the HIV has destroyed the immune system, the body cannot fight off opportunistic infections. HIV is transmitted through certain bodily fluids, such as semen, preseminal fluids, vaginal fluids, blood, rectal fluids, and breast milk. In my dreams, I'm drowning. At-risk populations and behaviors include unprotected sex, injection drug use, sex workers, and men who have sex with men. These groups are vulnerable because of the behaviors often practiced and the stigma that oppresses them. HIV can be prevented with condom use. When used correctly, condoms are 98 to 99% effective in preventing the transmission of HIV. Another way to prevent HIV is to reduce the number of sexual partners. Yet another way to prevent HIV is pre-exposure prophylaxis, or PrEP. PrEP is when an individual at risk of getting HIV takes a medication for treating HIV called Truvada, tenofovir, and emtricitabine to lower their risk by more than 90%. Truvada is taken once daily and works by blocking an enzyme needed for HIV to reproduce. Treatment for HIV has come a long way. It used to be that there was no treatment and people would die within 10 to 13 years. Since the development of antiretroviral therapy, or ART, the life expectancy of an HIV-positive person is nearly the same as a negative person. ART medications work by interrupting the life cycle of HIV so that it cannot reproduce. The National Institute of Health has continued to support research aimed at finding a vaccine for HIV and increasing knowledge about how HIV interacts with the human immune system. The CDC is involved in behavioral, diagnostic, vaccine, and biomedical research related to the prevention and treatment of HIV. For more information, visit cdc.gov/HIV.